Here at Pure Sports Medicine in London, we work with a wide range of patients. Very few of our patients are elite athletes. The vast majority of them are hard-working individuals who just want to get back to what they want to do as quickly as possible. Alongside our physiotherapy team, we have a lot of other exercise professionals, strength and conditioners, exercise physiologists, but we also have consultants in sport and exercise medicine, rheumatology and rehab consultants. We took this model from the model that exists in elite sport. Having a team of professionals, and especially professionals who focus on exercise and rehabilitation, means that you can open it up and provide a more varied and a more comprehensive approach to patient management.
Working with other exercise professionals means that we can use their knowledge, their expertise and their skills. You don't feel you're ever on your own. You can get help from somebody else or expertise from somebody else, and that's all really anybody wants when they're working with patients, is you always want the best for your patient and you know you're going to get the best. I also am then able to take their advice into my practice. We have joint sessions, so we can do joint sessions which are really helpful, whether it's between the physiologist or between the strength and conditioning coach. The patient comes in and you have a joint session there and there. Or sometimes we do case discussions in our clinic, which is actually really good for our CPD, where many of the team come together, our doctors included, and we all chat about a case, and therefore we learn that way.
The vast majority of our patients will come in and will see a physiotherapist for their initial appointment. Our patients are free to choose how they access the service, and the vast majority do see a physiotherapist as their first point. However, they may come in and see one of our other clinicians, or they may feel that actually what they need to do is get stronger and fitter in order to perhaps manage chronic long-term back pain. Now, we're very happy with that approach because we're very confident that all of our clinicians have the necessary skills and competencies, and if they feel that they need to involve one of their colleagues, that there will be appropriate cross-referral made to other members of the team.
Rather than a patient coming in and just having one clinician to try and look after everything, they're often signposted to a specialist, and then that specialist will then hopefully put the right treatment plan in place for them so that they're able to get back to their best as fast as possible. My role within the Pure Sports Medicine team is generally surrounded around exercise or physiological testing. So we will then use that testing to put a plan of action in place for that person. In other settings, in clinical settings, physiologists can work collaboratively with physicians or physiotherapists to put a treatment plan in place, certainly around the implementation and the delivery of clinical exercise programs, to hopefully allow them to perform at their very best as fast as possible.
We run an extensive CPD program for several reasons. One, it allows clinicians time to spend together outside of that patient environment, sharing knowledge and ideas, really optimising their understanding of the management of different conditions. The second thing that it does, though, is to ensure that we have consistent standards and consistent competencies around the management of various different conditions. And then lastly, it allows us to ensure that we are all communicating effectively with patients and that we're being consistent about our approach to that.
I've really liked how it's worked. It's been a seamless switch from the physio to strength and conditioning, because them working together made me feel like we were all on the same page at all time. It didn't feel like I was seeing a completely new person going to the strength and conditioning coach. When I was with the physio, the strength and conditioning coach would still come in, they'd discuss me as a patient, what they think I need to work on going forwards, both physically and mentally. So yeah, I think I've had a good outcome.
So musculoskeletal medicine, many clinicians have a broad capabilities in terms of their skills and their knowledge. And alongside physiotherapists, we know that they are capable of managing complexity and taking patients through from the early stages of their rehabilitation right through to high-level performance and advanced end-stage rehab. And while physiotherapists can do that, the big question is, are we best placed to provide care across the entire aspect of a patient's rehabilitation program? Or would we be better off working collaboratively with our colleagues to really optimise the outcome that we're achieving with those patients?